everyone. Thank you for joining us for today's Classroom to Community series. And today, going into November typically means open enrollment for many insurance carriers. So we wanted to take some time and review, give you some brief facts about understanding your insurance benefits. And with us today, we have Emily Weber, who is our Director of Revenue Cycle for Memorial Hospital of Carbon County. Following Emily's presentation on, again, a more global perspective of understanding your insurance benefits, we will be having Caleb Smith join us. And Caleb is with Enroll, Wyoming. He is the marketing director as well as a navigator for Enroll, Wyoming, and he's going to be speaking to us and sharing information about that program specifically and some of the different opportunities that are available if some of the traditional insurance packages maybe aren't a good fit for you. So with that, we'll go ahead and turn it over to Emily. Thank you.
So as Stephanie said, I am the Director of Revenue Cycle at Memorial Hospital of Carbon County, and we run into a lot of patients that come into the hospital not understanding their insurance benefits. Our number one question is, why did I get this bill? Why didn't my insurance pay, or why did they pay the amount that they did? So we're gonna go over some of those things today. When you sign up for open enrollment through your employer, most employers offer a low premium, high deductible option or a high premium, low deductible option. So essentially those mean if you choose a low premium, high deductible, less is going to come out of your paycheck every 2 weeks or every month, whatever your pay periods are, but you are going to have a higher deductible, meaning you are gonna owe more out of pocket at the time of service. Where if you choose a higher premium, low deductible option, you are gonna have more taken out of your paycheck each pay period, but a lower deductible, meaning a lower out of pocket at the time of service. So you just have to really plan for yourself. Are you single, married? Are you planning a family? Maternity costs are high, so do you wanna pay more out of pocket or pay more out of that paycheck? Do you have a flex benefits account? Those types of things are something to take into consideration when you are signing up during open enrollment. Always ask your human resources department. You can reach out to the hospital. We can help you understand your current benefits, but always also ask those questions to the insurance company themselves. If you are a local employer or human resources department, we are available to speak to your team about specific insurance packages during your open enrollment period. Reach out to Stephanie if you want to set something up for us to come in and speak to that. This is an example of those high premium, low deductible, and low premium, high deductible. So this is an example of an MRI of the spine. Our facility fee is $3,972, and the pro fee for that, meaning the radiologist who reads that test, is $787. Total cost is $4,759. If you have a low deductible option, so mine, for example, through my husband's employer, is $500. Our patient balance after insurance would be $1,351.80. That is including our $500 deductible, meaning none of my deductible had been met prior to the services rendered, with a 20% coinsurance. Where if you have a high deductible, I just chose $3,000 as an example, your patient balance after insurance is going to be $3,351.80, putting the first $3,000 towards your deductible. Once you've met your deductible, you will have a coinsurance. Typically, most insurances run 20%, so you will have 20% of any bill after your deductible up to a max out-of-pocket benefit, and that max out-of-pocket benefit is also going to depend on the premiums which you chose. If you have a higher premium, generally your max out-of-pocket would be lower versus your lower premium having a higher max out-of-pocket benefit. And this is all dependent on what insurance your company offers. Every insurance is different, so always ask those questions during open enrollment.
So Emily, with that, looking at this scenario, so at a glance, it would appear that the low deductible is the more favorable option. Can you talk a little bit more about some of the behind the scenes? And you touched on it, but can you go into that a little bit more?
So that lower deductible, again, is going to benefit you if you don't have the means to pay a larger balance out of pocket at the time of service. with that lower deductible, the first $500 in this example comes out of your pocket, whereas the higher deductible, $3,000. So it really depends on what you as an individual have set aside to pay those balances going into any medical care, whether you have a savings, health savings, flex benefits card, just a savings account in general. Credit card interest rates are high, so I mean, it's not something that we always suggest, but just keep those things in mind.
So again, on the high deductible though, your estimated balance after insurance, so in this scenario, you've met your deductible for the year, correct?
In this scenario, yeah, so say this was an MRI for your leg and you know, maybe they thought you've fallen and maybe broke your leg. So you're gonna meet your deductible getting this MRI, but now you have to have surgery to have the broken leg repaired. Your deductible for the year is already met. So now you're gonna start moving to that 20% coinsurance to your max out-of-pocket benefit. So your insurance is gonna pay as long as they approve the service, and we'll get into that. Your insurance will pay 80% of those services thereafter your deductible, and you'll be responsible for 20%. So reading insurance statements vary from carrier to carrier. We always encourage you, if you have questions, your EOB doesn't appear like it matches the bill, bring them into the business office and we will review and explain those benefits for you. One thing that patients don't understand a lot of the time is you will get multiple EOBs or explanations of benefits for one service. So on that MRI, you may receive 2 explanations of benefits, one for the facility fee and then one for the pro fee. So where MHCC is, we bill everything in whole, like we bill our facility fees and our pro fees ourselves, but not all facilities are the same way. So that's why they are billed out on separate claim forms. So example, a surgery at MHCC, as long as it's with one of our providers, we will bill that facility fee as well as that pro fee, whereas my daughter had surgery in Casper, I received a facility fee bill from the surgery center, and then I received a separate pro fee from the doctor's office. So that's why they're done separately, because not all facilities are like MHCC and bill everything themselves. So this is an example statement. This is actually a good example. So this patient had some multiple services. So this is what you would see on a patient statement. This patient had laboratory services, as well as, I'm trying to see the data service on the top one, it's really hard. Looks like the payments came through. I can't see the data service on that one, it's kind of blocked out. But then they had some labs on August 9th, as well as another service August 25th. So you can see we send one statement for all services as long as they fall within the same billing cycle. Right on the statement you can see the patient had, it looks like probably a clinic visit because there's a professional fee on here. So the lab services were $70, the physician fee was $300. Where it says patient payment, that was my, like this would be my example of a copay. So the patient paid the $15 copay at the time of service for their office visit. Insurance payment means that this patient's insurance paid $133. That contractual allowance adjustment of $169, that is the rate that the insurance has set up through MHCC. They are contracted to pay a specific percentage or price per service. So that contractual adjustment is not a payment that we received, but an adjustment that we made to that bill based on our contract with this individual patient's insurance. So leaving that patient balance at $53, and after I reviewed the statement, that was towards the patient's deductible. Same thing with the lab and professional fees. This statement in specific was a guarantor statement, meaning that patient had 2 children. They went to the clinic at the same time. They were both seen by the doctor, both tested for something in the lab, and they were both left with the exact same balance of $53 for patient responsibility. The visit further down, kind of the same thing. You can see $43 to the lab, $310 for the physician fee, and then there was some radiology services thrown in there for $324. Same thing, patient paid $35 for a copay. And your copays are gonna differ. If you're seeing a primary care physician, your copay may be only $15, where if you see a specialty service, such as an orthopedic or general surgeon, those copays tend to be a little bit higher, which is why this one was left at $35. Insurance made a couple of payments. Oh, the battery's low on the laptop. Insurance made a couple of payments, took a contractual adjustment there of $212.80. So overall, this patient balance for those 3 services was $678.70. And down at the bottom, you can see from this statement, total charges were $2,486. Insurance payments and adjustments were $1,742.30. And the patient payments were $65. Those again were those copays that were paid upfront at the time of service.
So Emily, on this scenario, so your comment a few moments ago on and again, insurance bills, depending on your carrier, can look very different. But the information that is reflected on your patient statement from whomever provided the services should match on those adjustments and your insurance payments. You should see that correlated directly over to your explanation of benefits. Is that correct?
Yes, so you will see the exact same thing that we see on this end. This is just more simplified, but on your explanation of benefits, you will see what your insurance paid, what contractual adjustment that they took from the facility, and then what they're leaving to your responsibility as a patient and why. It will say whether it's deductible, co-insurance, co-pay, and right on the explanation of benefits, it will say you may be billed X amount for X reason. Now it's frozen. There it goes. Okay, so this is just again another example of a patient statement. It looks like it was a clinic visit, professional or physician fee, visit with Dr. Williams on September 28th. Insurance was charged $415. They made a payment of $168, taking that contractual adjustment of $205, leaving only $42 to the patient's responsibility. So this is a great example of seeing those contractual adjustments. When you have your insurance, they have that contracted rate with the facility saying how much they will pay per service.
So can you talk about that a bit? What are some of the, how drastically do those contractuals vary from maybe some of the most common carriers that we see here in Carbon County? Can you talk about that a bit?
They do vary from payer to payer. Your commercial insurances are a higher percentage rate, and it's also gonna depend on your facility. Some facilities have we will pay $300 for an x-ray. Some facilities are percentage of charges, and so for us, Blue Cross Blue Shield is a percent of charges typically. I wouldn't know off the top of my head what the contract is, but roughly like 90% of charges, where your government entity insurances like Medicare and Medicaid only pay 50 to 60% of charges. So that means we're writing off 40 to 50% of a Medicare or Medicaid patient's bill.
Okay, so that brings up, yes, thank you for touching on that. So in those scenarios with Medicare and Medicaid, because again, it is contractual, we are not then allowed to, it is a write-off for the healthcare organization. It's not something that we can turn around and charge the patient for.
Correct, that is part of the insurance company's contract, is that we are gonna lower the amount that the patient has to pay. So it's saving the patient that additional cost.
Thank you.
So a couple of other questions that we get frequently is, why did my insurance pay for this service at 100% but not this service? And that is screening or annual wellness versus diagnostic. I had a perfect example of a patient that came in asking about their bill versus their daughter's bill. They had an annual wellness screen with that annual wellness blood draw where daughter was sick and needed to be tested to find out exactly what she had, so that diagnosis. So the screening, your insurance I guess most insurances, typical insurances will cover screening once a year. So once you hit a specific age, which is also dependent on your insurance, they'll cover an annual mammogram. They'll cover that annual colonoscopy or your annual wellness exam with a primary care physician. Those should be covered at 100% once a year based on each individual's insurance. Some insurances say you can get a mammogram at 40, some insurances are 35, also depends on your family history. So just make sure you again check with your insurance for those specific coverages depending on your carrier. Diagnostic testing means it's not something that you've already been diagnosed with and are looking to get answers for a specific treatment. So for an example, if you come in for a screening colonoscopy, but you have something that needs to be taken out for a biopsy, like a polyp or something, and we're sending it off to pathology, that turns that colonoscopy from a screening into a diagnostic, which means that colonoscopy is now gonna fall towards your deductible and max out of pocket. If you're going into your annual wellness screening and you haven't in the past been a diabetic, but your A1C was elevated, those additional labs are going to turn into diagnostic and will fall towards your deductible because you do not have a history of diabetes, but you are showing signs or symptoms. So those labs then turn into diagnostic.
So with that screening and wellness, those are, as in a true definition, those do not apply when you have those services done. Those are not being applied towards your deductible.
Correct. So MHCC offers estimate of charges and estimate of patient responsibility. There's been a lot of questions circulating about how we do that, how is it possible? We have a lot of great technology available to us. We have a prior authorization department at the hospital where any order for outpatient services, including radiology services, surgical services, that order comes down to the business office, to our prior authorization specialists. They take that order, send it right over to your insurance, asking, number one, does it require prior authorization? Number two, is it medically necessary based on the documentation that we give to make sure it's going to be covered for you? What are your benefits? So if it's a MRI to see if you have a broken leg or a diagnostic imaging, what is your deductible? How much of that have you met, and what they estimate they will pay versus what will be left towards your responsibility. All of our general outpatient services have a set price. Every MRI, CT scan, X-ray, ultrasound, mammogram that we offer is a set flat fee. So we do have the capabilities of pulling that up on the spot and telling you this MRI costs this much, your deductible is this much, your co-insurance is this much. We put your insurance right into the system. It will even take into consideration that contractual adjustment and tell us how much you owe. So it is possible. We do it as a patient courtesy just so you know and you're not surprised when you get that bill.
So it just, that reiterates the importance of one, elected procedures in particular. That pre-authorization step is so important. But taking, I guess I would encourage consumers to be really familiar with what their specific insurance carrier does cover, number one, but so doing that homework on their own, but then again, just that the billing office staff is available to, it doesn't even matter, I guess I would say it's not even if it's a MHCC bill, to come in and we can walk you through the specifics of your instance to help you understand the ins and outs of the EOB and the bill.
And even with emergent services, our staff in the background is doing a prior authorization when the insurance requires it. So we're not doing the service right then and there when it needs to be done, but in the background, we are reaching out to your insurance and making sure that they're gonna cover it as a benefit to that patient as well as to us as a facility.
So on the prior auth process, can you talk a little bit about what can a patient expect from the time they've come in, they've talked about, I know I need this procedure, I need this test. What is kind of that full circle and timeline in terms of being able to anticipate getting an answer on prior authorization?
So it all depends on each insurance. Some insurances are much easier than others. Some insurance we can just go out to the website, put that CPT code in, and they'll tell us whether or not it needs an auth. But irregardless of coverage of insurance company, we reach out to that insurance company as soon as we receive that order, request the prior authorization. Once it is approved, then we go into the eligibility verification piece as far as deductible, copay, coinsurance, those types of things. We ask, what is the patient's deductible? How much of that have they met? What can they expect to pay for this service? Once the prior authorization is received and approved, and we have that financial piece worked up, we call the patient and let them know. We received an order for an MRI. Your insurance approved the prior authorization. They did state you have a $500 deductible, of which none has been met at this point. So you will owe XYZ at the time of service. And so I know that we have a slide in here that will go into, what if I have a high deductible and I can't afford to pay that balance up front? And we do have a lot of options. So when that person reaches out to you, just let them know, what are my options? And they'll go over all of those. We even have a financial counselor on site that can assist with those pieces. Oh look, it's the next slide, perfect. So we have payment plan options, discount options available. Our self-pay discount, so self-pay meaning you do not have insurance at all. You are true self-pay. We offer a 25% discount for those patients. So even if you set it up on a payment plan with us, you'll get a 25% discount. We offer a prompt pay discount as well. Prompt pay is offered to insured patients as well as self-pay patients. So if you're paying promptly within the first billing cycle, so once you receive that statement, you pay in that first billing cycle, as long as it is not deductible, we will offer you a 25% discount to pay that balance in full promptly with us. We just cannot discount those deductibles because that is a contract with your insurance. So if you're self-pay and gonna pay promptly in the first 30 days or upfront at the time of service, we will give you both 25% discounts. So you'll essentially get a 50% discount if you're self-pay and pay upfront or within 30 days of that service. We have in-house payment plans up to 12 months and a minimum of $100 a month. We also offer extended payment plans for those who need it. We can set it up on an automatic payment plan. Generally, it only goes up to 36 months. On higher balances, we can push it out with special approval. If none of those options work for you, we also offer a financial assistance program. So there is an application for that. You provide some documentation and you can be approved for anywhere from 50% up to 100% of financial aid. So meaning we would write off 25, 50, 75, or 100% of your bill based on what you qualify for, and it is all based on household income. So again, we have that financial counselor at the hospital. I myself used to do that program. Our business office supervisor, any one of us, the clinics have the applications. They can hand those out to you. You can always reach out to us. Our phone number's on that application, so we can help you out and make sure that you have the best option that fits your financial needs. That's all that we had.
So I would just follow up with Emily's presentation and just state, again, reiterate that if you do have questions, our business office is available to help you navigate through that process, because it can be intimidating, and especially when you are in that instance where you know you need to have something done, and we're there to help remove that layer of confusion or stress. So we just would like to remind everyone of that. Thank you, Emily, for that information. At this point, we'd like to go ahead and, again, we have Caleb Smith with us with Enroll, Wyoming. And Caleb is going to speak specifically about that program and what Enroll Wyoming can offer some of the residents of Wyoming.
All right, thank you very much for the opportunity to talk today. Give me a second as I get the share screen set up on my end. I've been with Enroll Wyoming since December 2021, so this is my third open enrollment season. I wear many hats, primarily a marketing director, but I'm also cross-trained as a navigator, and I intend to use both of those hats today. There we go. Are you seeing the screen on your all's end?
Yes, thank you.
Perfect. All right. Enroll Wyoming, we're a statewide nonprofit that's our fundamental goal is to help people meet their health insurance needs. The majority of the time, that ends up being helping people find insurance, helping people understand health insurance. We want to be a resource that people can access kind of every step of the way, whether they're working from us in the start, we match them step for step, finding insurance, getting enrolled, being able to make the payments and then use it as they go along the lines. Or we're also there to jump in. We know a number of people that do a bit of research on their own and sometimes they hit a wall. They just want to double check where they're at, and we can parachute in and help as well. We always like to emphasize that our services are free. You're going to hear me say that several times because we're proud of it. Our primary goal is to just kind of empower people to make informed decisions. So today, the major things that I'm going to go over are what's the Affordable Care Act and the health insurance marketplace, what is Enroll Wyoming and how do we help people, and then who can I contact to get the free assistance that the free services that Enroll Wyoming provides. I'm going to stress I try not to just straight read the slides as much as I can. I'll be paraphrasing or giving additional information. I can email out the slideshow afterwards if people would like. I'll admit I was still tweaking it, updating it up until 11:58. But primarily the programs and other opportunities I'm going to talk about today stem from the creation of the Patient Protection and Affordable Care Act. We're celebrating the 13th year. The primary goals of that law were to make health insurance more affordable, make health insurance more accessible, and encourage innovation to make it easier to do those first two things. Overall, we're just trying to help the uninsured and underinsured. And as part of that, they created the health insurance marketplace, which is kind of a government-created bubble where people can go in and they can, whether you're an individual, family, nonprofit, small business, you can go in and look at certain health plans that have been specifically designed to be both affordable and have quality. One of the additional things about that is that to help make them more affordable is that people who are looking at these plans may be able to qualify for additional tax credits or other cost savings, whether they apply those up front to make the monthly payments easier or they can kind of get a tax refund at the end of the year. In general, the plans are similar to what's offered in the private marketplace, but it's just with some additional benefits that they're required to provide. And like I said, if you're going to your private broker, you're not gonna get those tax credits. In Wyoming, the two health insurance companies that participate in the marketplace are the Blue Cross Blue Shield and Mountain Health Co-op. I mentioned some of the benefits that they're required to have. The 10 essential health benefits you can see on the screen, ranging from prescription drugs, help with your ambulance services, prenatal care. Those are all things that, this is the minimums that they must require. If these aren't included, they wouldn't be offered in the marketplace. And many plans offer more. This is just the minimums that must be included. Talking about the benefits of the plans found in the marketplace, I already talked a little about affordability, like the tax credits and other cost savings and the health benefits. Another thing that's in people's favor is that children can stay on the plan until they're 26. I don't know about you all, but I wish that would have been an option when I was that age. One of the other major benefits is that pre-existing conditions don't have a financial penalty to them. While there are some private plans where you can be denied or you can only receive minimal coverage and then you have to pay a lot more, it's specifically balanced so that that's not counted against you. When it comes to eligibility and what people would have to pay, people are always asking that, and I'm going to be quick to go, it depends. Big picture, it will come down to your household size, your household income, and where you are. I will admit, looking at people, especially in the Southwest, a lot of plans I work with that. I see people who are similar income, similar household size, but they get offered better benefits in Carbon County than like Sweetwater County, for example. When it kind of comes to focusing in, getting a little bit tighter, they're going to be looking for people who meet federal poverty levels as a minimum. There's not a cap. We once had a navigator who, they were filling out a physical form with an entrepreneur who their income was higher than they had boxes to put the numbers in. They just wanted to try out the marketplace, and they didn't qualify for any of those cost savings I mentioned, but they were able to buy a plan. Another thing that they look for is if you were already offered an affordable job place plan. We put the affordable one in there because there are certain standards that the plans have to meet, whether about what they cover and how much they cost. They're constantly tweaking that number, but the most recent figure is that if the health insurance that your job offers takes up more than 8.39% of your household income, it's deemed unaffordable, which means that you could both apply for the marketplace and try to get some of those tax credits. I recently worked with a family where she just actually gotten a raise in that past week, and even with the raise, the insurance was taking up 10% of her health insurance. There's a couple extra steps you have to do to document that, to prove it, but that means that she qualifies for tax credits and other savings that she wouldn't otherwise. And the other general requirement that we remind people is that you have to be a U.S. citizen, national or documented resident. Under that categories, we recognize that covers a lot of different people with immigrant status as well. I mentioned the federal poverty level. There are some people who kind of fall into that gap, having just a little bit less than 100%, but those who do make 100% to 400% of the federal poverty level will qualify for tax credits that can add up to thousands, if not like $1,100, $1,600 I've seen with some couples. Some cases, they may fall between 100% to 250% of the federal poverty level. That still means there may be some cost savings that they qualify for, especially if they get a silver plan. And these numbers change from year to year. There are a number of people who, just because you qualified last year, you still have to double check that you qualify in the new year. And if all I've been rattling off seems a little bit convoluted, seems like you're a little bit worried about the changing rules, that's why Enroll Wyoming is here. Like I said, we're nonprofit, we're grant funded. We provide our services for free to be able to help answer questions, whether you're a small business, nonprofit, maybe just a guy working on their own. When it comes to our staff, we call our frontline workers navigators. They're there to guide you through the process, guide you through the questions that you may have. We especially emphasize that the information we provide is free, accurate, impartial, and confidential. We also want to throw in that we don't have any sales quotas, we don't have any sales incentives. I don't get a bonus if we get somebody to the end and they enroll in a program. I get a burst of endorphins for having helped a family, but we don't have a financial dog in the race. It's not like we favor one of those two health insurance companies more than another, and we'll help you with whatever stage it is, whether it's the finding a program, applying to see what you may qualify for the marketplace or for some of those tax credits, troubleshooting the application sometimes, and even sometimes the fundamentals like making sure that your health coverage, you make that for a payment and it goes through, and even a little bit more about the understanding so that people can use their health insurance with confidence. This is the busy time of year because open enrollment season has started. Normally it runs through January 15th, but just because it's a holiday this year, you get an extra day. We encourage people to, if they are going to take advantage of the health insurance marketplace, to use the open enrollment season because that is when the majority of people can sign up. There is a special enrollment possibilities for those who sign up late. It's primarily a major change in the household, like you've just had a major change in income, you lost a job, you just lost a bunch of hours, you've added somebody to the house, you've made a major move. Those are all things that could qualify you for special enrollment. though there's usually even a limited time frame involved with that too. In most cases, if you've just lost your job and you lost the job-based coverage that came with it, you would have 60 days to apply for open enrollment. After that, I've worked with people where you're like, well, it's good news, bad news. You missed the window, but open enrollment starts next week was an example I was recently working with. We'll come back together then. And if you know that there's going to be a major change, like you know you're going to be getting married, you know that there's a baby on the way, usually within about 60 days prior to that, you can connect with an Enroll Wyoming navigator and we can start to set up some of that. And certainly we could be reviewing some of your options and possibilities in advance. When people sit down with Enroll Wyoming, especially for open enrollment, we'll usually go over a couple, there's a short form that gives an estimate and there's a slightly longer form that gives an official determination that just kind of like based over who's in your household, who needs coverage. Maybe only you need coverage, but your spouse is taken care of, or you don't need coverage, but your kids do. We can go through that and we can get a determination pretty fast saying, yes, you qualify for the marketplace. Yes, you qualify for the marketplace, but you don't qualify for tax credits. We can work you through that. In a number of cases, they're sometimes going to ask for more information, and we can help with that as well. Right now, when people apply for the marketplace, this slide is, I'll admit from last year, but I believe that there are 24 different plans that are typically available for people to choose from. And we can help people sort through the results based on their priorities. I'm going to just quickly show a series of some bronze examples, some silver examples, and gold examples. Those are the three categories that are split up. As was noted in the earlier presentation, you're going to see the advantages of paying more upfront. Usually means you pay a little bit less later, or vice versa. You can pay less upfront with the understanding you'll be responsible for more later. There are going to be those people, they're just looking to have just basic coverage. Their emphasis is on looking for a low month-to-month premium. There are those who know that they're going to need to do a little bit more care, and so we can organize plans to make sure that they cover certain prescriptions, cover certain doctors or facilities. We can even further get into the weeds to look a little bit more about to see, well, is it going to be a flat rate for a doctor's visit, or will it be a percentage? I know I have this specific procedure coming up. As like I said, as the previous presentation talked about, there are going to be some cases where doing your homework and making sure that to see what you're responsible for and what the insurance will cover, that's an important part of the process. We are happy to take as much time as possible with people to make sure that they have an idea and it's hopefully meeting their needs and their priorities as much as possible. Like I said, open enrollment is going on right now, so that's our emphasis right now. But Enroll Wyoming answers a lot of other questions too, especially throughout the year, whether that's questions about Medicaid, Kid Care Chip, Medicare, private insurance, COBRA, or even just being able to understand how you use your insurance. I'll admit, I was one of those people for years where I'm like, I have insurance, I'm doing everything I can not to use it for fear that I'm going to screw it up. I've gotten a bit more confidence in that over the years. It's one of those things that we just want to be able to take care of themselves the best they can, and insurance is one of those things that is part of risk management. We recognize that in a lot of cases that a lot of sometimes literal heartache and trouble can be saved by being able to be more preventative or more proactive about your care than not. When it comes to the people serving the Southwest, we recently took my name off the website for the Southwest because we have a new navigator named Katie Beefus. She's smart, she's sharp. She wanted to be here today, but she had a family emergency that precluded us. But we're both in Rock Springs, Wyoming, and we're happy to jet up the road to help out in Rawlins, or we're also available for Zoom calls like I'm doing today, or phone calls. We recognize there's some people they have to meet in person, and we'll do that. When it comes to additional resources, Enroll Wyoming's our main website. There you can find additional information. You can find videos, our contact sheet just in case you've misplaced this, copies of our newsletter. I'll also emphasize that when it comes to the work we do, we rely a lot on referrals and word of mouth. So hopefully, maybe everybody in the room's listening to me, you all are in a good position. But maybe if you hear like a friend that they just lost their job, you may know a neighbor who the primary breadwinner just passed away and the family's still trying to figure out the coverage. Or in some cases it might be, you may know a couple that they want to retire early, but they're not quite sure what they're going to do for health coverage. Those are all situations where we are able to sit down, figure out what the family's priorities are, figure out what their needs are, and hopefully outline some options, some resources that they may not know of, so they can make smart decisions going forward. So I know I just threw a lot of syllables at you all. I appreciate that. Any questions?
I don't think we have any at this time, Caleb. Thank you so much for that information and bringing awareness to this type of a resource. Again, that's available for Wyoming residents. So thank you. We appreciate that.
Well, we appreciate your all's time, and as soon as we're done with this Zoom, I'll email my notes and the PowerPoint so you can share that with your network as well. Thank you for your time today.
All right, thank you, Caleb. All right, with that concludes today's Classroom to Community. Thank you for joining us, whether you were in person or virtual, and stay tuned for more information about our next Classroom to Community. Thank you.